Almost any seizure can present in either a more mild form or moderate form or more severe form. And that's the tough part about epilepsy. It's hard to predict what seizure type an individual might have. An isolated seizure, one-time seizure, is literally that, one time. And it's actually more common than we think. Up to 10% of people can have an isolated seizure. Epilepsy, or another term for it, is seizure disorder, is when you have recurrent seizures. So we normally think about it in the traditional sense of 2 or more seizures over a 24-hour period. That definition has been extended to one seizure with a potential of having a high risk of a second seizure. If someone has their first seizure, the first thing to do is get immediate attention. And in the emergency room, they're best equipped to handle the problem. Whether that will be just a single seizure or whether that will develop into epilepsy, there's definitely some routine blood tests. The blood sugar is checked. If it's very, very low, then that's a correctable cause of a seizure. Checking all the blood work to see if there's any other reversible causes, such as low sodium, low calcium, low magnesium. In some cases, if somebody took a non-prescribed medication that may have caused a problem, a urine drug screen also would be helpful. And eventually they will go for imaging, such as a CAT scan. If there's an abnormality on the CAT scan, sometimes people get even more defined imaging, such as MRI, or what we call a magnetic resonance imaging. When patients are first diagnosed with epilepsy or seizure disorder, it's traumatic, but we tell them the good news is you can lead a very normal life. Most people with epilepsy can be treated with medications.